in this session, let's talk about two things, right? Let's talk about respiratory. Let's talk about respiratory rates and contraction during labor. Right. Now let's talk about these two things. Let's be fast with it. Now, respiratory rate during labor, right? Labor is a moment, right, during pregnancy, right? The baby is ready to come out, right? The baby is ready to come out. That is when the baby is ready to come out. Now, during the whole process of labor, which include 4 stages, right? We the mother go through what? High level of physical activity, right? It involve, let me say, it involve high level of physical activity. So related to this high level of physical activity, right, it cause what? The respiratory rate to be high, right? Now take for instance, right, let us say you are going to the gym, right? You are going to the gym, or you want to go for a walk, or you want to like jog, whatever you want to do. You're going to the gym, you want to go for a walk, or you want to like just jog, right? Something like that. Now, all these 3 things, right, will cause your respiratory rate to be high, will cause your heart rate to be high. Now, because your respiratory rate or your heart rate is high, does that mean you have a chronic condition? Obviously no, because it's these activities that is causing what? Your heart rate or respiratory rate to be high, right? It's that same thing that happened during labor. Because of the high physical activity during labor, that's why the mother heart rate is high. So guess what? If we say you don't have a problem right here, right, because these are high, so it also means that if this is high during labor, it means that there is no problem. So now when you see on the NCLEX exam and then your question is telling you the respiratory rate is high, yes, you don't care. NCLEX can tell you 21, NCLEX can tell you 26, 28, the respiratory rate here is high, right? Guess what? Is expected, is no problem, right? Is expected. Now let's talk about the contraction part. Now, when we are dealing with contraction for the NCLEX exam, contraction, right, related to the normal range. Now let me explain something, and I'm going to give you my shortcut. Now, contraction is measured in frequency and is measured in duration. Duration. Right. Contraction is measured in frequency and is measured in duration. Now, throughout the 4 stages of labor, right, contraction occur, right? So this is how the stage works. Stage 1, we have 3 phases. We have the latent, we have the active, and we have the transition, right? Now, stage 2, that is the birthing stage. Stage 3, that is when you are trying to like remove the placenta, right? Stage 4 is recovery, right? Now, throughout this stage, contraction occurs, as I said, right? This part, contraction, we say is frequency and duration. So this part right here, we have contraction starting from 5 to 30 minutes. I'm going to give you my shortcut, so just pay attention. 30 to 45 seconds, right? Then we have 3 to 5 minutes. Then this is 45 to 60 seconds. And then we have 2 to 3 minutes. This is now 60 to 90 seconds, right? So this 2 to 3 minutes is the same thing right here. 2 to 3 minutes, 60 to 90 seconds, right? Same thing, 2 to 3 minutes, 60 to 90 seconds, like all throughout labor, right? This is the last part that appear all throughout labor. Now, guess what? If you are to study the normal range for contraction, you have to like know this right here. Now, but when the NCLEX want to test you related to contraction, whether the patient is having too much contraction, is related to this timing. Now, instead of you to cram all this timing, right, I've turned it into a simple process whereby, one, you want to understand, okay, NCLEX is testing me related to contraction normal range, right? That's the first thing you want to know. NCLEX is testing you related to contraction normal range. That's the first thing. So since you know NCLEX is testing related to contraction, now you want to pay attention to that question, because that contraction question can be testing you related to frequency or can be testing you related to duration. So you want to pay attention to know which one the NCLEX is testing you, because once you can identify which one the NCLEX is testing you, you can be able to apply what? The normal range. Right. Now, the normal range for frequency I'm going to give you, the shortcut normal range is think about 2 to 30 minutes. Right. Now, for duration, think about 30 to 90 seconds. Now, nobody will tell you this, but this is a shortcut to knowing the normal range, right? You don't need to know all this, right? Leave this for when you start working in the maternity unit, whereby somebody will ask you when the patient is in latent stage, what is the expected frequency or duration. Leave that. NCLEX will not test you that. NCLEX will just test you. What NCLEX wants you to understand is that NCLEX wants you to understand the normal range, right? Relate in general, not in related to each of these. No, NCLEX wants you to understand it in general, in the sense that you can know what is abnormal, because NCLEX is a safety test. NCLEX wants to see if you can identify something that is abnormal, right? Abnormal is when it's outside less than 2 and when greater than 90. Duration is going to be a problem when it is higher than 90. Frequency is going to be a problem when it is less than 2 minutes, right? So just write it like this and just circle the first and the last and say this is less, this is high. So anything that is less than 2 minutes is a problem. Anything that is greater than 90 seconds is a problem. Now, but on the exam, how would you be able to identify that your question is testing frequency or duration? That's the thing now, because NCLEX is not going to write contraction frequency. NCLEX is not going to write contraction duration, but they are going to put a certain keyword. Right. So what's that keyword? Now, frequency, when you see that contraction question, right? Frequency, if you want to know NCLEX is testing frequency, NCLEX is going to put every. Now, for duration, right, NCLEX is going to put lasting. So pay attention to that question. NCLEX can say contraction occurring every. You see, that every will now send you that signal that NCLEX is testing frequency. Or NCLEX can say contraction lasting, right? So you now understand that lasting is duration. So the moment you spot every, think about frequency. The moment you spot lasting, think about duration. And then next thing you want to think about the normal range. 2 to 30 minutes, 30 to 90 seconds. Right. So now if I tell you a patient have contraction occurring every 30 seconds. Right. So now you are going to ask, is the NCLEX testing frequency or duration? Every is frequency. So what's the normal range? 2 to 30 minutes. So you can see this is less than 2. Right, it's less than 2, so this is a problem. This is a red flag. This is a problem to the patient. Now, contraction occurring every 70 seconds. Sorry. Okay, I want to give the second example, right, which is contraction lasting every 70 seconds. Now you are not like, oh, lasting is duration. The normal range is 30 to 90, so it falls within that normal range. So this is what? Good. Right? Contraction occurring every 3 minutes, right? So every 3 minutes is frequency, is within the normal range, so this is good, right? Contraction lasting every 120 seconds, right? Lasting, right? So lasting 120 seconds, this is more than 90, so it's a problem, because lasting is duration is a problem, so you know it's a problem, right? So right, we've been able to cover what? Respiratory rate and contraction, right? Respiratory rate that is high during labor is good, and contraction, you need to pay attention to the frequency and what? Duration, right? Frequency is every, duration is lasting. The normal range is 2 to 30 minutes. Normal range here is 30 to 90 seconds, right? So once you apply this to your question, you'll be able to answer it successfully, and I'm going to see you in the next one.